Today's video is one that could change your life or the life of someone you care about. We're going to explore coronary artery disease, or CAD, and the lifestyle changes that can help manage it, slow its progression, and reduce the risk of heart attacks. If you've been diagnosed with coronary artery disease, you may be feeling overwhelmed or uncertain about what comes next. The good news is that lifestyle changes, what you eat, how you move, how you handle stress, and more can make a powerful difference in your health of your heart and your blood vessels. We'll also take a close look at two essential dietary strategies, the Mediterranean diet and reducing refined carbohydrates, and how they support heart health. Let's get started. Coronary artery disease is the most common type of heart disease. It happens when the arteries that supply blood to your heart muscle become narrowed or blocked by buildup of plaque. This plaque is made up of cholesterol, fats, inflammatory cells, and other substances that collect on the inner walls of your arteries. Over time, as plaque builds up, it reduces the flow of oxygen-rich blood to your heart. That can lead to chest pain, also known as angina, or even a heart attack. But CAD isn't just about symptoms. It's about what's happening inside your body. Even when you feel okay, damage can be occurring silently. Fortunately, many of the risk factors that lead to coronary artery disease, like high blood pressure, high cholesterol, type 2 diabetes, obesity, and smoking, can be improved or even reversed through lifestyle changes. And while medications are often necessary, your everyday choices are just as important. One of the most powerful tools, your diet. Scientific research has shown us something incredible. Coronary artery disease isn't necessarily a one-way street. In some cases, people who adopt comprehensive lifestyle changes, especially in what they eat, can actually halt or partially reverse the progression of the disease. This doesn't mean giving up everything you enjoy, but it does mean shifting your habits toward ones that support your heart rather than damage it. This includes moving more, eating better, quitting smoking, managing stress, improving sleep, and building social support. Among these, diet is a key factor because what we eat affects cholesterol levels, blood sugar, blood pressure, weight, and inflammation, all of which play a role in CAD. Let's take a closer look at the Mediterranean diet, a proven approach to eating that's both heart healthy and delicious. The Mediterranean diet isn't really a diet in the traditional sense. It's more of a pattern of eating inspired by the traditional diets of countries like Greece, Italy, and Spain. It emphasizes whole, unprocessed foods that are rich in nutrients and antioxidants. People who follow a Mediterranean-style diet consistently have lower rates of heart disease, stroke, and death from cardiovascular causes. It's one of the most extensively studied diets in the world, and its benefits have been confirmed in people with and without existing heart disease. What makes it so effective? The Mediterranean diet focuses on foods that support blood vessel health, reduce inflammation, and help lower bad cholesterol while raising good cholesterol. It includes plenty of vegetables, fruits, legumes, nuts, seeds, whole grains, and olive oil. Fish is eaten regularly, while red meat and highly processed foods are limited. Meals are often built around plants rather than animal products, and flavor comes from herbs, spices, and fresh ingredients, not salt or sugar. Another important aspect is the use of extra virgin olive oil as the main fat. Olive oil is rich in monounsaturated fats and contains antioxidants that protect your blood vessels from damage. And it's not just what you add to your plate, it's also about what you take off. One of the most overlooked aspects of heart health is the impact of refined carbohydrates. These are foods that have been stripped of their natural fiber and nutrients during processing, like white bread, sugary cereals, pastries, white rice, and many packaged snacks. Refined carbohydrates cause rapid spikes in blood sugar and insulin, which over time can lead to insulin resistance and increase the risk of type 2 diabetes, a major risk factor for coronary artery disease. They also promote inflammation, raise triglyceride levels, and contribute to the development of fatty deposits in the arteries. In fact, several studies have shown that diets high in refined carbs can be just as harmful to the heart as diets high in saturated fat. By reducing or eliminating refined carbs and replacing them with whole grains, legumes, and fiber-rich vegetables, you not only lower your blood sugar and insulin levels, but you also improve your cholesterol profile and reduce inflammation in the body. People with coronary artery disease who cut back on refined carbs often see improvements in energy levels, blood pressure, and weight, all of which contribute to better cardiovascular outcomes. So what does a heart-healthy plate actually look like? Think of it this way. Fill half your plate with non-starchy vegetables like leafy greens, broccoli, peppers, and tomatoes. Use extra virgin olive oil to dress your salads or cook your vegetables. Include a serving of whole grains such as quinoa or barley, or legumes like lentils or chickpeas. Add a portion of fish like salmon, sardines, or trout a couple times a week. If you eat poultry, stick to lean cuts and keep red meat to an occasional treat. Snack on nuts or fruit instead of chips or cookies. Choose water or herbal tea instead of sugary drinks or sodas. And when it comes to dessert, try a piece of dark chocolate, fresh fruit with plain yogurt, or even a few dates with nuts. These satisfy your sweet tooth without spiking your blood sugar. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, while diet is a foundation, it's just one part of the lifestyle puzzle when it comes to managing coronary artery disease. Physical activity is another key component. Regular exercise helps strengthen the heart, lower blood pressure, improve cholesterol, and maintain a healthy weight. Even walking 30 minutes a day, 5 days a week can have measurable benefits. If you've been sedentary or have limitations, start slowly and talk to your healthcare provider about a safe plan. Cardiac rehabilitation programs are also a great way to begin. Quitting smoking is one of the single most important things you can do for your heart. Smoking damages the blood vessels, increases clot risk, and accelerates plaque buildup. If you smoke, ask your doctor about resources to help you quit, whether it's counseling, medication, or support groups. Stress management also matters. Chronic stress can increase blood pressure, raise inflammation, and trigger unhealthy behaviors. Techniques like mindfulness, meditation, deep breathing, or spending time in nature can help you manage stress more effectively. Sleep is another pillar. Aim for 7 to 8 hours of quality sleep each night. Poor sleep, especially from conditions like sleep apnea, is linked to a higher risk of heart problems. And don't underestimate the power of community. Having the support of friends, family, or a support group can help you stay motivated and reduce feelings of isolation as you make these changes. You don't have to change everything overnight. Start with 1 or 2 changes that feel doable and build from there. Maybe it's switching from white bread to whole grain. Maybe it's taking a short walk after dinner. Maybe it's preparing a Mediterranean-style meal once a week. Over time, these small steps add up, and they matter more than you might realize. Research has shown that people with coronary artery disease who make comprehensive lifestyle changes, like improving their diet, increasing physical activity, quitting smoking, and managing stress, experience fewer cardiac events, improved quality of life, and in some cases regression of the plaque in their arteries. These changes don't just help you live longer, they help you live better, with more energy, less pain, and more time doing the things you love. Living with coronary artery disease can be scary, but it's also an opportunity. An opportunity to take control of your health, to nourish your body, to rebuild your strength, and to connect with others on a similar journey. By embracing a Mediterranean-style diet and cutting back on refined carbohydrates, you're giving your arteries the best possible environment to heal. By exercising, quitting smoking, sleeping well, and reducing stress, you're creating a lifestyle where your heart can thrive. You don't need to be perfect, you just need to be consistent. Thank you for watching. As always, take care of yourself and make the most of your day.